Hi, my name is Lauren, and I'm going to be doing my heart and lung video first. I'm going to scan the room. Okay, so before I go in my patient's room, I would check the chart, make sure I have the right patient. I would provide for privacy, wash my hands, introduce myself. My name is Lauren. I'm going to be your nurse today. And what brings you in?
Check out.
Are you in any pain?
No.
Are you on any medications?
No.
Do you have any allergies?
No.
Okay. So I'm going to start with my heart assessment. First, I'm going to do the carotid arteries. I would palpate one each at a time. So they're about a 2+, and then I'm going to listen. So you're going to feel my stethoscope in 3 places, and if you could just hold your breath for me. Yeah, right now. Okay, so I didn't hear any bruits. The sound was normal. Next, I'm going to do my skin inspection. So overall, looking at his skin color on his chest, I don't see any cyanosis, any pale colors. His skin is appropriate for his ethnicity. He has pink undertones. The only thing I noticed is just tattoos and then some small macules. The temperature is normal. It's warm to touch. It's dry. It's not moist. And then I'm just going to palpate. And I don't feel any masses or anything like that. So then I'm going to listen for my cardiac points. The first one's going to be aortic, and that's going to be the second intercostal space, midclavicular line. My second one is going to be pulmonic, and that is the left second intercostal space. My third is going to be Erb's point, which is going to be the third intercostal space, left sternal border. The fourth is going to be tricuspid, which is going to be the fifth intercostal space, left sternal border. And then the fifth one is going to be mitral, and that's going to be the fifth intercostal space midclavicular line. So S1 and S2 were audible. I didn't hear any murmurs, any gallops, any extra sounds. The rate and rhythm was normal. And then I don't see any PMI. I don't feel a pulse right here. I don't see any heaves or lifts. I don't see him using any accessory muscles to breathe. Next, I'm going to do my pulses. I'm going to do radial first. That's a 2+. Then I'm going to do his brachial arteries. And that's a 2+ as well. And then while I'm up here, I'm going to test his strength. So if you could just grab my fingers. Pull me. Push me. Okay. And that is normal as well. I'm going to move down to his hands and do cap refill on his middle 3 fingers. So it was normal, less than 3 seconds. Same with the right hand. Then I'm gonna move down to his arteries down here. So the first one's gonna be under the knee. That's the popliteal artery. And it's about a 1 plus. I'm gonna do the other side. It's about a 1 plus as well. And then while I'm back here, I'm gonna do the posterior dorsalis pedis, which is gonna be on the inside, back here towards the ankle. And that's about a 1 plus. Same on this side, then I'm going to do the dorsalis pedis artery on top of the foot. It's about a 1 plus. Same with the left side, about a 1 plus. And then I'm going to do the cap refill for the feet. Just take your socks off. And that's normal, less than 3 seconds. And that's normal as well, less than 3 seconds. And if I could just have you do 2 leg raises with each leg. And then his leg strength is normal. Next I'm going to do my respiratory assessment. I'll have you turn around. So just inspecting the skin back here. The temperature is again dry to the touch. It's warm. It's not moist. Pink undertones of the skin appropriate for ethnicity. Just some macules and a tattoo on the right shoulder. So next I'm gonna palpate. And I don't feel any abnormal masses or any bumps or anything. Next I'm gonna do my AP diameter. So I'll take my hands right here, and it's gonna be a 1 to 2 ratio back here, so that's normal. Next I'm gonna do symmetric expansion. So I'm gonna grab him right here, and can you take a deep breath in for me? Out. So both of his lungs raised equal bilaterally. So air was getting out of both of those equally. Next I'm going to do, and I didn't notice any crepitus when I felt his chest, any like crackling or anything under the skin. Next I'm going to do tactile fremitus, so I'm going to have him repeat the word 99 every time I hit his chest. So every time you feel my hands touch your chest, say 99. So the sound was resonant. It diminished slowly as it went down the chest wall. So next I'm going to listen in all my spots. Okay, so all breath sounds were present in all lobes. I didn't notice any adventition sounds, no wheezing, no rails, crackles, anything like that. Everything was normal. Next, I'm going to percuss across the posterior chest. So I would be taking my finger and hitting it on the part with the bone, and I would be going in between the intercostal spaces. So this would be the second intercostal space. And I'll go from side to side. Okay, so the sound was resonant. I didn't hear any tympani or any dullness in the sound. Then I'm gonna have you turn around. So then I'm gonna do the same on the anterior chest. So I would palpate. Don't feel any masses or anything, and then I'm gonna do symmetric expansion. So if you could just breathe in for me. So his lungs raised equal bilaterally on both sides. And then I would listen for all my sounds. Okay, so all breath sounds were clear in all lobes. I didn't hear any adventitious sounds, no crackles, wheezing, rails, or anything like that. Next, I'm going to do tactile fremitus, so every time I hit your chest, say 99. Okay, so the sound was resonant and it kind of decreased as I went down the chest wall. Next, I would percuss over the chest. And again, I'm doing that in the intercostal spaces to avoid the bone. Okay, and the sound was resonant. There was no dullness or anything like that. So then I just have one more assessment piece before I do my subjective data. So I'm just gonna have you lay down on this real quick. With your head facing that way. So now I'm gonna check for JVD, which is jugular vein distension. And palpating, I don't feel any on each side. You can sit up. So if I did notice some distension when he was laying flat, I would then have him lay at a 45-degree angle to confirm that. So then I'm just gonna ask a couple questions for my subjective data. Do you have frequent upper respiratory infections? Do you smoke?
No.
Do you have trouble breathing?
No.
Do you have chest pain?
No.
Do you cough up blood or anything like that?
No.
Do you have family history of respiratory infections or cardiac problems? And you're not on any medications? Do you wake up in the middle of the night to urinate frequently?
No.
how many pillows do you sleep with at night?
One.
Okay. So that is about it for my subjective data, and then all my assessment. Before I would leave, I would make sure my patient is comfortable, they have their call light, they have everything they need, and then I would go document what I had just done.